thing is, I think it was part 3 I missed, is what can go wrong? What are the complications? And any surgery brings multiple complications, and I usually tend to kind of group complications depending on the particular surgery that you're performing. In limb lengthening in general, there are always risks of the joints above and below the limb being lengthened, either dislocation, stiffness, or contractures. The bone itself might not heal. There's blood vessels that can be either injured at the time of surgery, it can be injured during the lengthening process, nerves that can be injured or irritated during the lengthening process, a host of orthopedically centered issues. The blessing is that they're extremely rare, and to date I've had less than 1%, probably less than 0.5% incidence of issues of nerve injury. As far as bone healing, we've had 100% bone healing. Sometimes it takes, if someone has a difficulty in healing their bone, it might require some other surgeries to correct that. But at the end of the day, I've achieved all bone healing. Limb alignment, you want to make sure that you maintain the straightness of the leg or the arm in both rotation and kind of not inducing any secondary deformities. And so there are a host of things that can happen. They're extremely rare. I think some of the non-orthopedic issues, we look at basically the overall health of the patient, heart, lungs. You're undergoing anesthesia, which is very safe in this modern day, but there's still risks. One issue with, especially with the bone dysplasias, are the central nervous system and the amount of space available for the spinal cord and nerve roots. And there are certain situations that put patients at a much higher risk, if, especially with a thoracolumbar kyphosis or a spinal deformity that has been corrected, places you at a much higher risk of really any type of, having a secondary stenosis, which would then place you in a different protocol to achieve a safe lengthening result. It also places you in a protocol for a different preoperative assessment to ensure that there's no problems that that would sneak up on you. And I'm sorry if there's background noise. That's, believe it or not, that's my dog snoring. So I apologize. But I think, did that cover everything, Chandler, for the first one?
Yeah, it did.
And then, I think if a patient's not having